Shelby's a wonderful place. We've got a great community. One of the best things that we have going for us is that we still see ourselves as a community.
When there's issues to be addressed, our community has a great track record of coming together and trying to deal with those issues when they arise.
We're in the middle of nowhere, but in the center of everything. Socioeconomics, our median income's a tick under $40,000, so we're fairly low-income community.
And some parents just can't afford to take their child to the doctor. Some parents don't have transportation when their child gets sick.
Most general practitioners and child health clinics are not open after 5, so if mom works an 8 to 5 job and junior comes home from school and feels bad, there's not very many options. And so typically what we've seen is inflated emergency room visits, or the child just doesn't get the appropriate medical care needed at all.
We saw here at this specific school a high number of children that was absent, and that led to parents having to leave their jobs. So that sprung forth the conversation first as it relates to, okay, what are we going to do to address these concerns?
We finally had this aha moment that with innovative technology, we can access those kids in their rhythm of life.
Hey, how are you? Good, good. Okay, I'm gonna get you to step up here on the scale for me.
The telemedicine project started at Graham Elementary, and I think over the last year or so, it's been called telemedicine, telehealth, virtual health. But really, regardless of the name, the idea is that we provide health services to the student at Graham Elementary School.
Oh, there's Dr. Gritton calling us.
Hey, girl.
Hello.
How you doing?
I'm good. How are you?
It allows doctors to actually see the patient without actually being in the same room with the patient via a facilitator that's in the room with the patient.
Say, Dariana. That's a gorgeous picture. Look at that uvula, Maritza. Thank you, Dariana. That's gorgeous. I got it.
They have the high definition camera. They have the otoscope attachment to look at your ear.
No ear infection there either. Thank you, Maritza.
And they can take pictures to keep in your record, which is neat as well.
The quality of care that you can give using this innovative technology is magnificent.
Another one?
Absolutely love it. This is so good. The whole time they keep me in the loop.
So Deidre, darling, Dariana sounds okay. She has a little bit of wheeze, nothing that's severe. I think she's fine to stay at school.
Even though we're not face to face, we still communicating with each other, and that's the key of this virtual visit.
And they can even write prescriptions, so when they get off work, they can go by and pick up the prescription. It's already done.
So to make the school-based virtual practice come together, it took a lot of stakeholders, our school system leadership, our health department leadership, and Atrium organization leadership.
For so long, communities have been doing to and not with and through. And that is a model of we know better than you, so we're gonna do it to you, we're gonna fix you. And those models are not sustainable, and they don't lift and empower communities. And we were committed that this pilot would look different, that we were not going to run it that way. And so when we came in as a contractor to help move this pilot forward, we needed to create an advisory council of community.
What we're calling Partnering for Community Prosperity. And Partnering for Community Prosperity is a multi-agency, cross-functional partnership aimed at really investing in the youth and focusing on social determinants of health. One of the wisest things that our team did was in the very beginning, we recruited a community quarterback to work 100% as an advocate and to be a liaison between the community and the public agencies that are trying to provide these benefits.
And my job is really just to connect people to the resources, recruit, so to say, individuals to come around the table to address social determinants of well-being.
It only makes sense to do that together and as a collective bunch. When you begin to think about the resources, we are so much stronger together. It's amazing.
We spent about 6 to 7 months meeting with various individuals in the community. From there, we formed a focus group and met a few times. And then we had a chance to intermingle with local churches, barbershops.
Our school system is taking care of more than just an academic need. And so you're starting to see a more holistic approach to taking care of young people, and I think telehealth is right in the middle of that.
I
I just think that it's so exciting to bring this kind of technology into a community like this because it works. When you get a call from a school nurse, you no longer feel like you automatically have to go pick up your child.
And we saw about a 33% reduction in early dismissal from school by the school nurse.
So since they started this virtual visit, she hasn't missed no school.
That means moms and dads, parents are at work more. So, I mean, the impact is not only with school, but it's got an economic impact.
Our whole goal was to improve access to care, but as a big pediatric practice in town, I thought, well, we take care of all the children. No children go without care. And some of the leadership at Graham Elementary said, yeah, you think that, Dr. Clinton, but you're a little bit wrong on that one. And 20% of the children we saw in that initial year didn't have a medical home, didn't have a primary care doctor, so their home was the emergency room. That was a little astonishing to me.
Since telemedicine, we've seen almost a 65% reduction in unnecessary emergency room visits. We're setting up a generation to do better than their parents did and to do things differently than their parents did. And that's pretty powerful stuff.
This program has been amazing, and the outcomes are truly showing the benefit of the money that's been invested in it. But one of the challenges we have is the way that our state is currently set up. It is very difficult for us to bill for this type of telemedicine within schools. This absolutely should be self-sustainable. When you look at the cost savings from the outcomes, it is a no-brainer that we should be able to restructure the way we have our agreement with the federal government around Medicaid to allow us to bill for these services.
I have not met a parent yet that doesn't want the best for their children. We don't always have the resources to do what's best for our children, and telemedicine makes that available for our parents.
It has completed the puzzle between home, school, and the doctor's office. It is just that piece that was missing.
Now, I'm one of the parents who really do need this. I'm a full-time mom, a full-time student. I have a special needs child, and when Dr. Grant introduced this to me, it changed my life.